For someone who's not vaccinated, who heard you say yesterday, you're not going to change the date, then hears you say today, the date's changing. What's going to sort of tell them that you're serious about this date and that in a month from now, they're not going to get another 30 days? What's going to actually make them sort of take that final step?
If we give them today this olive branch, it's because we realize that over the next few weeks, they really can make a difference. They're really part of that team. And as I mentioned yesterday in Gatineau, I saw some people coming back to us from retirement because they wanted to help their previous colleagues who are really in deep trouble right now in certain area. And I think the people that are inside right now, that are not vaccinated, can make a big, big, big difference. So if we give them a little bit more time, given what their professional association have told, maybe late to me in the process, but they've done it this week, and I appreciate what they've done. I think that providing them additional weeks to make their mind could make a big difference. And as I said, at the speed that we are still vaccinated, first dose for employees, I think we could have a big difference in 30 days. And that's what I'm still positive about it, to provide this olive branch.
What's the point of a deadline if it can be broken without consequences?
Well, I think there are two big consequences for those employees that are not vaccinated. Their premium will be terminated by that date. I think that's a big number. They will not receive their signing check of $5,000. They will not be eligible anymore for what we call the COVID premium, the 4% and 8%. I think this is a big disadvantage.
And the other one, or are those both of them? You said there were two.
Well, I'm saying on the cash side, there are two types of premium that will be terminated. And if you get into, a temporary mode, then you lose the benefits of you're not accumulated your pension. You're withdrawing on the list of preferred for holidays and for all sorts of benefits. So there are monetary and non-monetary disadvantage.
I know you said that you're optimistic that you can convince people, but we've spoken to healthcare workers who don't want to get vaccinated, and they don't want to get vaccinated. Wasn't the hard deadline a major factor in getting those people that you have gotten vaccinated, recently vaccinated, and now that's essentially gone?
Well, I think honestly, it's easy to go back. You want to comment on that, Lucy?
To say that one would be completely inflexible on a hard deadline faced with facts, I'm not sure that would be responsible. I don't know that would be a responsible way to act, given the needs of the population to receive healthcare and social services. So it was not, as the minister said, an easy decision. We were all discussing it late last night. But at one point, one also has to make sure that the checks, that the advantages and the disadvantages are balanced. The minister also mentioned, in answer to a previous question, that the College of Physicians already a few weeks ago came out with a suspension of licenses to practice, and that really moved physicians to get vaccinated because they couldn't go into telemedicine, they couldn't go into anything else. So now the other orders, the other large orders, have very recently come out with that. So can we give those individuals a chance, now that they see that their orders are following suit, to now get vaccinated? So I would say that those are some of the issues also that we put into consideration.